This is a story about the silent spreaders at a time of a global pandemic. There is evidence from infectious disease modelers globally that the severe acute respiratory syndrome coronavirus 2, the SARS-CoV-2, has the ability to spread silently. Person X is infected with the virus, but Person X does not feel sick at all. He doesn't have a fever, he doesn't cough, he's never tired. His throat is not sore, he still has his sense of taste and smell. Neither is his nose runny, nor is he experiencing shortness of breath or any chest pain. Because he feels okay, he goes on with his life as normal, mingling with other people. But he soon notices that other people who have been in contact with him are starting to get sick.
That person who is asymptomatic might be carrying live virus in behind the throat and behind the nose. They might even be carrying them in the lungs.
It is a bit early in the infection that the virus has not yet manifested, or it could be that even if it causes mild symptoms, this person is not yet showing.
Asymptomatic group is the most difficult to identify because symptomatic is what you see easily. It's like the tip of the iceberg. What we don't know is how efficient, if you are asymptomatic, you are able to pass the disease to the next person.
Why should we worry about an infected person with no symptoms at all?
It may be that they will cough or sneeze once in a while, not continuously, because the virus is in the saliva and in the other droplets, be able to transmit this either to a surface. If people are greeting each other, close contact of any sort, or even when you're laughing or talking in close proximity, it's possible to have this virus transmitted.
That's one of the reasons why people are wearing masks. So the viruses that are inside your nasopharyngeal region do not enter the environment and contaminate people.
The WHO puts the R0 or RO of COVID-19 at 2 to 2.5. This means that an infected person can infect at least 2 to 3 persons. But because Person X is in the community for long, they have the potential to infect more people and become super spreaders. In Kenya, so far, out of 15,792 tests, 320 have been confirmed positive. What is of great concern is that 67%, more than half, of all who have tested positive are asymptomatic. But is this reflective of the entire Kenyan population?
It's hard to say this represents the entire population because we've been doing targeted screening. For us to be able to know the real numbers, we would have to do screening randomly in the public and some sort of mass testing. Of course, not every Kenyan can be tested.
Some asymptomatic infected patients still test positive even after being in isolation for 14 days.
It means that they are potentially shedding the virus, and so you need an additional number of days to see that the virus is cleared by their body. Between 28 or so days or within a month, a lot of people are able to clear the virus.
However, Person X in isolation who is not being treated for any symptoms may become disoriented and undergo stress. It is important, experts say, that they understand that isolation is not just for the individual, but to protect the population that he can potentially infect. And in many cases, counseling is necessary to process the period of isolation. In the event the symptoms begin to manifest, they are much safer at a health facility where they can be treated.
But in a few cases, as we see, some patients may proceed to become critical. Sometimes switch from fairly moderate illness to a very severe illness with very little warning. But of course, for the person who is running around not having symptoms as such, having mild symptoms, may not then suddenly become breathless. There's a sequence to it.
But the symptomatic person is not the only silent spreader, according to some health researchers. There is Person Y, the pre-symptomatic infected person who is incubating the virus from 5 to 14 days, but doesn't yet show symptoms. About 75% of people who test positive without showing symptoms turn out to be pre-symptomatic, displaying coughing, fatigue, fever and other signs of COVID-19 in a later follow-up exam. Person Z, the other silent spreader, is a very mildly symptomatic infected person. This one only feels mildly unwell, but the more they come into contact with people, the more they infect others.
Kwenda mass testing wakienda, then tutapata exactly wale ambao wako na hii ugonjwa but hawashow hiyo dalili.
We have a big proportion of people who get infected ending up requiring the health care, hospitalization and critical care. Then we are on a very dangerous ground.
The silent spreaders still walk among us, unknown, still shedding and spreading. Dorcas Wangira, Citizen TV, Nairobi.